This is the review from class, Chapter 10 of the Claywell Book. Theory-based practice provides a systematic, knowledgeable approach to patient care. This contributes to the professional growth of the nurse and the nursing profession as a whole. The most common concept in nursing is person, nurse, health, and environment, and that's the four universal concepts central to nursing practice. Nursing theories serve as guidelines for professional practice and are influenced by values and beliefs and influence professional behaviors. Nursing theories are conceptual models and are abstract concepts that propose outcomes. It's an integrated set of concepts and statements that can be used to explain, describe, predict, or control a phenomenon, and may be developed using inductive or deductive reasoning. Deductive reasoning proceeds from the general to the specific. Inductive reasoning proceeds from the specific to the general. Philosophies are nursing conceptual models and provide a broad explanation of the world, express beliefs about nursing and nursing-related values, provide broad global explanations of phenomena of interest that contribute to the nursing knowledge, and serve as guides for professional practice and influence professional behaviors. Nursing conceptual models are composed of a defined and interrelated set of concepts. They are building blocks of a nursing theory that is initiated based on the personal philosophy or belief about nursing. Many are abstract or concrete and describe and classify a phenomenon of interest. It is thought of as an idea that must be clearly defined. And constructs are similar to concepts, but they're more abstract. A middle-range nursing theory focuses on answering specific nursing practice questions. They can describe phenomena, explain relationships, and predict the effects of one phenomenon on another. Nursing theories in general are built on adaptive scientific theories and should be clear, simple, generalizable, important, and accessible. Conceptual models or nursing frameworks are related constructs that broadly explain a phenomenon of interest. They're structures that guide the development of a study, also called a paradigm, which is detailing organizing framework. Conceptual models are interrelated definitions and concepts organized for viewing phenomena specific to nursing. Developmental or physiological theories would be like Maslow's theory of the hierarchy of needs, Erikson's theory of psychosocial development. Developmental theories explain the interdependence of the systems in the body, helping to reveal the presence of health and illness. Systems theories describe the relationship of the environment, both internal and external, with the individual and how changing one part affects all other parts. Role theory describes how roles of individuals in their family may change over a lifetime. It helps nurses function therapeutically in interactions, and it helps to understand behaviors. Adaptation theory helps nurses to understand adjusting or adapting to stimuli. Florence Nightingale's theory of nursing primarily focused on the environment. It described in detail the concepts of light, cleanliness, ventilation, warmth, diet, and decreased noise. Her theory focused on three major relationships: environment to the patient, nurse to the environment, and nurse to patient. Virginia Henderson is well known for defining nursing. She is credited with integrating the view of holism into nursing. She believed that humans have needs that are not only biological, but also psychological. Her definition of nursing is to assist the individual, sick or well, in the performance of those activities contributing to their health or recovery or to a peaceful death. Hildegard Peplau is known as a mother of psychiatric nursing. She developed the theory of interpersonal relations that focuses on the nurse-patient relationship. This is grounded in practice and based on the belief that the goal of nursing should be directed toward reducing dependence and encouraging autonomy. This theory describes the connection of nurse, patient, health, and environment and should be viewed within the context of environment. Dorothea Orem. The theory of self-care deficit is composed of three theories: nursing systems, self-care deficit, and self-care. In this model of practice, the outcomes of all nursing action should be to promote self-care in all individuals. Activities of self-care are defined as purposeful, ordered, and learned. The degree to which a person is able to participate in this is called self-care agency. So self-care deficit would be the degree to which a patient is unable to perform self-care. And appropriate care is developed through three operations: diagnostic, prescriptive, and regulatory. Dorothy Johnson focused on human behavior in a behavioral systems model. The goal of nursing is seen to assess the internal and external environments and help a patient select mutual goals and develop interventions. Persons are composed of 7 interrelated behavioral components or subsystems that function together to form a whole: attachment, dependency, ingestive, eliminative, sexual, aggressive, achievement, and restorative behavior. The conservation model was developed by Myra Levine. It is based on 3 concepts: wholeness, adaptation, and conservation. Conservation occurs in 4 areas: energy, structural integrity, personal integrity, and social integrity. Health or well-being of the patient, or wholeness, is sustained through adaptation, a process of change in which conservation is the outcome. So what would be an example of how to adapt if a patient can't walk on their own? An example would be the use of a cane, a walker, a wheelchair, and these would all be application of the Levine's conservation model. Imogene King developed the theory of goal attainment. Her theory is based on her belief that humans are composed of 3 interacting systems: personal, interpersonal, and social, and that they can lead to goal attainment and representing outcomes. Creating a method to evaluate outcomes, defining quality nursing care, and setting goals are reflective of King's theory that emphasize goal setting and evaluating outcomes. So the goal is health for individuals, groups, society, and the world. The Newman systems model focuses on responses of patient systems to actual or potential stressors and uses primary, secondary, and tertiary nursing interventions for optimal wellness. Caring for the patient at any one of these levels should be to evaluate the patient's stability and evaluate the effect of stressors on the patient, and these are examples of the clinical application of Newman's theory. Madeline Leininger. She distinguished the term transcultural nursing. She felt that nurses need to realize that humans are complex beings who want their holistic views of life, care, culture, and health to remain together and do not want to be viewed as fragmented organs or body parts. Demonstrating cultural competency includes learning about the cultural community as in individuals, their families and communities, and their expressive abilities of caring, values, beliefs, actions, and practices that are based on their cultural lifestyle. This will help ensure that nurses deliver the appropriate level of care respectfully based on these aspects, with the noted increase in nursing satisfaction, performance, healing, and well-being. Ida Jean Orlando. The nursing process theory. The goals of the nurse is to meet the immediate needs of the patient and relieve distress or discomfort, and nursing practice should be autonomous. Nurses must explore the patient's thoughts, feelings, and perception, and assessment includes verbal and nonverbal behaviors. Using the nursing process in the provision of nursing care provides an overall framework for nursing and is effective in achieving a good outcome. Margaret Newman. The theory of health as expanding consciousness, and it focuses on patterns, life processes, and wholeness. Life process is a progression toward higher levels of consciousness and health, and Newman believed that health and the evolving pattern of consciousness are the same. Interactions that occur between the environment and the person are key processes. Both health and illness can be seen as the manifestation of the pattern of the person environment. So nurses need to listen to the rhythm of another person's interactive pattern, whether it's irregular, difficult to sense, or chaotic, and nurses need to hang in there with their patients until a new rhythm emerges. Sister Callista Roy for the Roy adaptation model, and this explains the ability of living things to adjust or adapt in response to continuous internal or external stimuli produced by altering the environment. This theory illustrates how humans cope or do not cope with physical, developmental, emotional, intellectual, social, and spiritual stressors. Roy believed that the goal of nursing is to promote adaptive responses through a 6-step nursing process. assess the behaviors, assess the stimuli, formulate a nursing diagnosis, set goals to promote adaptation, implement interventions, and evaluate whether the goals have been met. Jean Watson's theory of care emerged from her own values and beliefs, guided by her commitment to the caring, healing role of nursing and its mission to help sustain humanity and wholeness as the foundation of health and nursing's purpose for existing. It is organized around 10 character factors that honor the human dimension of nurses' work and subjective experiences of the people they serve. The formation of a humanistic, altruistic system of values, the installation of faith and hope, the cultivation of sensitivity to oneself and to others, the development of a helping, trusting relationship, the promotion and acceptance of the expression of positive and negative feelings, the systematic use of scientific problem-solving method for decision-making, promotion of interpersonal teaching learning, and a provision for supportive, protective, and/or corrective mental, physical, socio-cultural, and spiritual environment, assistance with gratification of human needs, and lastly, the allowance for existential and phenomenological forces. Nola Pender presented the health promotion model, and it is based on the belief that the patient is able to manage their own health actively and focus on wellness. The focus on wellness helps to clarify the nurse's role in health promotion, and it focuses on 10 determinants of health promoting behavior, such as prior related behavior, personal factors, perceived benefits to an action, perceived barriers to an action, perceived self-efficacy, activity-related affect, interpersonal influences, situational influences, commitment to plan of action, and intermediate competing demands and preferences. Patricia Benner. We've already talked in detail previously about novice to expert, but she mainly focuses on clinical nurse practice and the belief that nursing knowledge accrues over time. The 5 levels of skill acquisition were novice, advanced beginner, competent, proficient, and expert. The nurse is using a caring, healing paradigm with 10 character factors to plan nursing care. Which nurse developed this philosophy? The correct answer is 2, Jean Watson. Patricia Benner would be novice to expert. Virginia Henderson is known for the definition of nursing. And Nola Pender developed the health promotion model. A nurse wants to use Imogene King's model to plan nursing care. Which principles should the nurse remember? The correct answer is number 3. Human beings are the focus of nursing care, and the goal is health for individuals, families, communities, and the world. According to Imogene King, the human beings are the focus of nursing care. Number 1 is discussing Peplau. Number 2 is Betty Newman, and number 4 is Myra Levine.